What overlooked first aid topics appear on Step 1? Imagine studying for the United States medical licensing examination and thinking you have all the bases covered. Then, a question pops up on a topic you barely glanced at. That's why knowing what often gets missed in first aid for Step 1 can make a big difference. While most students focus on high-yield facts, some important details tend to slip through the cracks. These less obvious areas are fair game for exam questions and can trip you up if you're not prepared. Let's start with basic science concepts. Many students skim through biochemistry pathways or molecular biology mechanisms because they seem complicated or less exciting. But the exam might ask about how a metabolic pathway relates to a disease or how a mutation affects a protein function. Memorizing pathways isn't enough. Understanding their clinical relevance is key. For example, knowing the difference between glycogen storage diseases or how mutations in specific genes lead to certain syndromes can be tested. Pharmacology and microbiology are other areas where details often get overlooked. Students tend to memorize major drug classes but miss subtler points like rare side effects or mechanisms of resistance. For instance, knowing that vancomycin can cause nephrotoxicity and red man syndrome is common, but understanding how bacteria develop resistance through altered cell wall synthesis is less so. Microbiology questions might include atypical presentations of infections or rare organisms like nocardia or actinomyces, which are easy to forget but important for diagnosis and treatment. Anatomy and embryology are also fair game. Many focus on high-yield structures but skip developmental anomalies or embryologic origins of organs. Questions might ask about the blood supply to the thyroid gland or the embryologic basis of a congenital diaphragmatic hernia. These topics seem minor but can appear in clinical vignettes, especially when testing your understanding of how structures develop and relate. Behavioral science and biostatistics are sometimes neglected because they seem less clinical. But the exam often tests understanding of study designs, statistical tests, or ethical principles through case scenarios. For example, questions may ask which study design best answers a specific question or how to interpret a confidence interval. Being comfortable with these concepts helps you answer questions that are not straightforward. Pathology and physiology are core, but students sometimes miss the nuances. For example, understanding the differences between similar diseases like multiple sclerosis and neuromyelitis optica, or recognizing subtle signs of endocrine disorders, can be tested. Physiology questions may involve feedback loops or homeostatic mechanisms that are not directly covered in textbooks but are essential for understanding disease processes. To avoid missing these topics, use first aid as a foundation but go beyond it. Practice with question banks to identify weak areas. When you see a topic in first aid that seems minor, spend extra time reviewing it in other resources or lectures. Teaching these concepts aloud or discussing them with peers can also reinforce your understanding. Keep track of your performance on practice questions and focus on areas where you're weaker, even if they seem less important. Remember, first aid is a great starting point, but it's not everything. Covering overlooked topics like foundational science details, subtle pharmacology and microbiology facts, embryology, behavioral science, and nuanced pathology will help you face the full range of questions on Step 1 confidently. Active review and targeted practice are your best tools to fill in these gaps and boost your exam readiness.